High blood pressure, also known as hypertension, is a condition where the pressure of the blood flowing through the arteries is higher than normal. This elevated level of pressure can lead to many risks throughout the body and can lead to the disruption of many processes and can ultimately increase the risk of many conditions such as coronary artery disease, stroke, heart failure, peripheral vascular disease, vision loss and chronic kidney disease. High blood pressure is usually caused by lifestyle factors as well as being genetically predisposed, making up about 90 to 95% of cases, hence being known as primary high pressure. Lifestyle factors can involve having excess sodium in the diet, high levels of body fat, smoking as well as alcohol. Secondary high blood pressure on the other hand is caused by an identifiable cause, which is oftentimes chronic kidney disease or even the use of birth control pills. While high blood pressure doesn't have any distinctive symptoms in itself, there can be many associated conditions and signs that high blood pressure may be affecting your body and causing damage. When left untreated, high blood pressure can cause the following symptoms in the body, which may worsen over time. If you are experiencing any of the following symptoms, chances are your high blood pressure may be placing you at risk of developing further conditions and should be addressed immediately. 1. Headache. Generally the first sign of experiencing high blood pressure, the tension on the brain can cause a severe headache. These headaches can come in the form of just a dull throbbing to a debilitating migraine. The reason behind the headache is linked to the blood vessels in the brain, which swell due to the higher instance of blood in the system. This swelling then places pressure on sensitive areas of the brain, causing pain to radiate throughout the head, in the temples and even down through the neck. Pain can be treated by taking ibuprofen or paracetamol, however these should not be taken too frequently. 2. Vision problems. With the extra pressure placed on the brain due to the swelling of the blood vessels, one's vision can also suffer as a result. The vision problems can become more pronounced as the condition worsens. Vision problems can be sensitivity to light, auras, blurry vision or any combination of these, and are often caused as a result of the swelling and damage to the blood vessels located at the back of the eye in the retina. In more severe causes, hypertension can cause a related eye disease known as hypertensive retinopathy. 3. Irregular heartbeat. An often alarming sign, particularly for people with high blood pressure, is having an irregular heartbeat. The condition is known as a hypertensive heart disease and is caused by the heart working under increased pressure as a result of high blood pressure. This symptom is one of the most concerning for those who are suffering from high blood pressure and can ultimately lead to heart failure, heart attack or a number of other conditions which can increase the risk of death. The condition can be caused by the narrowing of the arteries due to the increased blood flow or the enlargement of the heart due to overwork. 4. Chest pain. For a number of reasons, high blood pressure can lead to sharp pains in the chest. This chest pain can be related to the respiratory system or the heart itself, as the pressure increases in the large arteries from the heart and to the lungs. These arteries can harden and narrow as they work harder, leading to increased pressure through the circulatory system and a lack of oxygen reaching the lungs and heart, resulting in pain. Many people suffering from high blood pressure can incorrectly diagnose the pain as cardiac arrest or heart attack. 5. Fatigue or confusion. With the arteries tightening and blood struggling to move through due to the increased pressure, the lack of oxygen to the lungs can cause issues of fatigue or dizziness. This is due to a lack of oxygen reaching the brain, meaning your body will not only be receiving enough blood to the rest of the muscles and organs, but the oxygen-starved brain will lose its cognitive ability. This will mean decisions can take longer to make and though processes will be more challenging. This exhaustion can make it more difficult to perform everyday tasks, meaning exercise, work and study are much harder for people suffering from hypertension. 6. Difficulty breathing. As previously mentioned, the lack of oxygen in the blood reaching the lungs mean the lungs are unable to perform their vital job. As the brain and organs around the body suffer from a lack of oxygen, the brain attempts to kick the lungs into overdrive by sending signals that more oxygen is required to be taken in. This leads the sufferer to feel as though they have a shortness of breath. They take shorter, deeper breaths to compensate. This can further increase pressures of the circulatory system, and the more oxygen required, means the heart works harder to spread blood through the body. 7. Throbbing. When the heart starts going into overdrive and there is an increased pressure of blood running through the body, you may start to feel a pounding in locations around the main arteries. Likely areas to feel this pounding are the chest, neck, ears or temples on the side of the head. This pounding is usually in time with your heartbeat, giving you an idea of your pulse rate, but it can be quite uncomfortable given the tension of the throbbing. It helps to avoid activities that will place strain on the body, such as exercise, when feeling this symptom. 8. Blood in the urine. High blood pressure also places strains on the kidneys, which can be quite dangerous and lead to blood in the urine. The reason behind this is due to the frequent stretching and scarring of the blood vessels in the kidneys. This damage causes blood to leak through into the kidneys and be processed along with waste. This causes a reduction in the ability of the kidneys, which can have a detrimental effect as blood pressure rises due to the increased level of fluids in the blood, further causing damage to the kidneys. 9. Nosebleeds. While not particularly common in most people who are treated for high blood pressure, nosebleeds have been reported by 1 in 6 people in a study of people treated at the hospital for high blood pressure emergencies. The reason for this is possibly due to the small blood vessels in the nose bursting and expelling blood. However, nosebleeds could also be contributed to a variety of factors such as dry air, frequently blowing the nose, allergies or sinusitis. A nosebleed due to high blood pressure could be an indication that you might be having a hypertensive emergency and should be taken seriously when combined with other symptoms. 10. Facial flushing. Having a red, burning face can also be an indication of high blood pressure. Flushing is not exclusive to the face, with the neck and ears also experiencing similar symptoms. Facial flushing is caused when blood vessels in the face are expanded. While flushing can occur due to a number of reasons such as exercising, stress, weather, allergies or alcohol, all of which are temporary, high blood pressure is not usually the direct result of facial flushing. Instead, it can just be an indication that blood pressure in the face is much higher than standard. 11. Blood spots in the eyes. The hemorrhaging of the tiny blood vessels in the eyes is what causes the redness or red blotches in the white areas of the eyes. This could also be in conjunction with the loss of vision and damage caused by retinopathy. The small blood vessels in the eye are susceptible to higher blood pressure and can be easily damaged. This can lead to further conditions, which can add to the risk of vision loss, such as the buildup of fluids under the retina and the aforementioned nerve damage due to the blocked blood flow to the vital areas of the eyes. 12. Tinnitus. Tinnitus, or the ringing of the ears when no sound is present, is another symptom, which can take effect due to the high blood pressure. The ringing may sound like a clicking, hissing or roaring and can be quite frustrating to a sufferer who cannot escape the sound. The sound can be a variety of pitches, volumes or taking place in either ear. The condition is mainly the result of the increased flow of blood in the tiny blood vessels of the ear, placing pressure on the small hair cells of the inner ear.